I'm Sam Sacasa from NAVC's Vetfolio and the host of this Tech Takeover edition of Vet to Vet. As technicians, we often spend a good amount of time with pet owners in the exam room, and this is a great opportunity to talk to them about what they're feeding their pets and how to make sure they're offering the best nutrition for each stage of life. Here to talk to us about how technicians can take the lead when educating pet owners about nutrition is Vicky Ograin. Vicky is a veterinary technician specialist in nutrition, and after a lifelong career in private practice, in 2001 she began a new career with Hill's Pet Nutrition, where she is a scientific communication specialist focusing on the veterinary healthcare team. Vicky, it's so great to talk to you today.
Thank you so much for having me. I'm so excited to get to talk about this. This is my favorite subject.
As technicians, what do we need to look for when evaluating a pet label? I know that that's something that a lot of technicians want to be able to do for their clients.
Yeah, and that's a really good question, because we know that clients are going to come into the clinic with a food. They're going to look to us as the experts, understand what we think about this food, and you may not know anything about it. I always start by looking at the front of the bag. Gives you some information. So is there an adult looking cat or dog? And then I actually look at the AAFCO statement, or the nutritional adequacy statement. This tells us a lot about the food. And then you can look at the pet that's in front of you and decide if this is the right food or not. So for example, if you have an older dog and it's an all life stage food, which is most appropriate for gestation, lactation, and growth, that may not be the right food for that particular pet. And just by looking at the bag, by looking at that nutritional adequacy, or we call it the AAFCO statement, that gives you so much information, and then you can decide if this is the food that you want to recommend or not.
Yeah, I think that that's really interesting because as consumers, we're taught a lot of times to look at ingredients when we're evaluating our own diet. So you didn't mention ingredients. Why is that?
Yeah, and that's actually probably one of the things that I look at least, although I know that that's what the pet parents are looking at. So it's kind of like,
Right.
why am I not looking at that? Because honestly, all it tells you is what are the ingredients in the food, right? And that makes sense, but it doesn't tell you anything about the quality, about the bioavailability, the digestibility. It doesn't tell you if there's excesses of nutrients like phosphorus. The AAFCO statement can actually tell you that a little bit better. So if I look and I see all life stage, I know that's going to have high levels of phosphorus. You look at the ingredient label and it may have chicken as the first ingredient, but you don't know how many minerals are in there. So what is the phosphorus level? So honestly, if I'm about, the only thing I do with the ingredients is if I know that there's a food allergy, but really then you're probably looking at a therapeutic food, not a wellness food. So again, I don't really look too much. There is some information if there's particular ingredients you're looking for. You can see if there's extra in there, like extra antioxidants, omega fatty acids, things like that. But honestly, I don't get a lot of nutritional information nutrient information looking at that ingredient label.
That's really interesting. And I think that technicians, if they know how to look at the AAFCO label correctly, will maybe feel a little bit more empowered to evaluate a pet food. So, going back to that AAFCO label, how are life stages deciphered, and why is there no category for older pets?
Yeah, and I wish there was. So AAFCO has 4 different life stages that are approved for dogs and cats. So all life stages, which has to meet the highest demand for nutrients in a dog or cat's life. So that's truly gestation, lactation, and then maybe growth. So maybe depending on, you'd have to look at that. And then adult, and that's it. So that's truly the definition of all life stage is gestation, lactation, growth, and adult. Okay, so that's one life stage. Then you could see growth alone. Then the next life stage is gestation, lactation, and that you will always see together. And then adult, or adult maintenance, you might see, or maintenance. And unfortunately, at this point, AAFCO has not established a senior. So if you see senior on a bag, so if the front is senior something name, right? That's actually just marketing. And that's why looking at the AAFCO statement is really important, because you will see foods that on the front of the bag say that they're for seniors, But you look at the AFCO statement and it actually says it's for all life stages, which may be appropriate for some senior dogs and cats, but may not. And so this really empowers you to look at the front of the bag, see senior, and then look at the back or the side panel for that nutritional adequacy statement. And if you see all life stage, then that allows you to make a decision. So what you really want to look for a senior pet is adult maintenance would be the one that we would recommend. And then what I recommend as a VTS in nutrition is also look for a company that understands senior nutrition. And those are the companies that are testing and doing research and particularly looking at that senior life stage. And so they're understanding the nuances of what type of protein we need, more bioavailable and more controlled minerals, which we know is more important as those pets are aging.
That's really surprising, even to me. I've had senior pets and I've fed them senior diets and assumed that they were appropriate. So that's information that I'm sure a lot of pet owners don't have. I know that you've mentioned in the past calling the company. Why
Mhm.
might this be a good idea for a pet owner to do?
I really think that, it's something that we should empower the pet owners to do. So the American Animal Hospital Association put together these amazing nutrition guidelines. And within that, there were questions to ask a pet food company. Wasava has taken on those questions. So either one has a handout, which I think is amazingly great. And this is something I would give to the pet parent and allow them to call the company. It has things like who develops your food? Are they PhD in nutrition? Are they boarded veterinary nutritionists? Do they have other PhDs? What quality controls do you have? Are you doing feeding trials? Do you analyze your actual food? And those are very important questions. And we know that our pet parents desperately love their pet, right? And they want to do what's best. So have them call the company. If the company hangs up on them or won't tell them or says it's proprietary. Now, I'm a VTS in nutrition and I work for Hills, as we know. And so if someone called up Hills and they said, I want to know, I want to know the VTS's name, well, that might be a privacy thing, right? But I want Hills to tell them, yes, absolutely, we employ boarded veterinary nutritionists, PhDs, and we have a VTS in nutrition, right? I want them to tell them that, not my name. So I'm not thinking that they need to do that, but they need to, yes, absolutely, be proud of the fact that they have those types of people on, VTSs and veterinarians and PhDs on staff. And to me, if I'm looking for a company and I'm looking for those type of answers, and the company's saying, no, we don't have anyone on staff, or we use a consultant, well, then they can put that information together, bring it back to the veterinary staff, to the technician, and then have a discussion about it. And that's going to empower you to decide if this is a company that you want to recommend or not. But I also think if the company just flat out hangs up on them, is that a company you really want to feed their food to your loved pet? So that maybe takes care of having to have that conversation, right?
Yeah, absolutely. I think that seeking that transparency is really important. So, changing gears a little bit, how can we use patient history to evaluate a pet food for a particular patient?
Yeah, so I mean, I think when we are going into a room and talking to the pet parent about their pet, particularly if you're thinking about maybe it's time for a therapeutic food. What happens a lot of times in a clinic is the veterinarian will say, we're recommending this therapeutic food, say it's a renal disease, and say they're going to put them on KD. If the receptionist just hands them the bag and says, oh, this is the food the veterinarian's recommending, feed it, goodbye, the chances of that owner really understanding why they're feeding that food and embracing it and switching over to the new food is probably not all that great. But also the important part is when you're doing that history to begin with, is you need to ask them what they're currently feeding. And I always say, what are you currently feeding? And you can't judge. You have to be very happy. Oh, you're feeding toast. Great, lovely, yum. And put some butter on that toast. Oh, you do. Oh, I love that, right? You can't judge because the minute you judge, they shut down, right? So you're asking them what they're feeding, getting the list of everything that they're feeding. And then the other thing that I ask is why. This is really going to help you as you're thinking about how am I now going to help the owner, the pet parent, to switch over to this new food. So that is really, to me, is very, very important to really start that conversation. And understanding why is really important. You have no idea the different things that I've heard from different owners. And understanding that, being compassionate to why they're feeding that food. It could be a friend, a neighbor, the internet, but sometimes there's also some very personal things that are going on as to why they're feeding those foods. For example, I had one pet parent that was going through a bitter divorce, and so they were overfeeding their pets, and their pets were overweight. If I hadn't understood that, it would have been harder to switch these dogs over to a weight loss food, which is really what those dogs really needed and deserved. But without understanding that, it wouldn't have been as easy. And they were the ones given the toast with the butter. So yes, we still included it, but in a more appropriate amount, a responsible treating, as I like to call it. And so we were very successful in getting weight off those pets. But if you just hand the pet parent a bag of food and say, here you go, you're not going to have as much success. So I truly believe taking that history, understanding all that they're feeding, and then asking why, and with compassion, then understanding and then helping them navigate as they are switching over to that new food. Really, really important.
Yeah, that is so important. I'm glad that you brought that up. Not just finding out what they feed, but why,
Right.
and being able to kind of gain their trust so that you can have those conversations. Because a lot of times, especially if it's a therapeutic diet, it can
Mhm.
be pricey and it can be, you can
Right.
only feed them those sort of treats. It's like very restrictive, that owners might get frustrated if there's not a real conversation about it.
I think also sometimes with therapeutic foods, they've been told that their pet has a condition that might be, something that could be devastating. You've just my cat has kidney disease. That's an awful diagnosis, right? So we're navigating that as well when we're switching over to a new food because we know that that food is going to help them as they navigate that condition, lengthen their life, quality of life, but the owner needs to process that. And so that's what we really can be helpful and instrumental in, and as they are switching over to that new food.
So, with that, talking about older pets, what are some examples of different health considerations that you look at when evaluating a food for an older pet?
Yeah, certainly. So, I mean, if we're thinking about a wellness food, and is that what you're kind of asking about? Is more the wellness food first before we're thinking therapeutic?
Sure, yeah.
Okay, yeah. So, with the wellness food, I think it's really important to look at a food. Just don't look at the front of the bag. There's a lot of really great marketing that goes on in the front of that bag, and that's great. But you got to look at the other parts of the bag as well. You got to look at the nutritional adequacy statement. Look at the guaranteed analysis. Also, when you're looking at dry or can, you cannot compare them because the guaranteed analysis is on an as fed basis, meaning the water is still included. So a dry food is going to appear to have a higher level of protein than a canned food. So particularly for senior pets, you might look at a canned food that maybe has, say, 11% protein. Boy, that sounds really low. That's great, right? But you take the water out, that food actually has closer to 50% protein. So you want to be really careful when you're looking at a can or a dry, because the dry, say like a renal diet, might have 24, 25% protein on the guaranteed analysis compared to 11%. That sounds better, right? You take the water out of that dry food, that's more like 26%. So now you're comparing 26% of a therapeutic renal diet that has controlled levels of minerals, but also other things added like omega fatty acids, fiber, things like that. You're comparing that to a food that has really 50% protein, and likely with that level of protein also has a very high level of phosphorus, calcium, sodium, which those are the minerals that we're really concerned about. So phosphorus for kidney disease, calcium, because we know a lot of these older cats and dogs are more prone to calcium oxalate bladder stones. Sodium, salt, right? We all know that older pets sometimes don't need that high level of salt, particularly if there's hypertension. We also know we can see diabetes with our kitties, hyperthyroidism. So those are things we want to look out for. So we want to make sure that we're giving nutrients. So not therapeutic yet, because we're not diagnosing. But if we've got those older pets that are going along, and we want to keep them with us as long as possible, because that's our goal, right? We love our pets and we want to keep them around as long as possible. If we're giving them foods that are a little more controlled in some of those nutrients, they're not going to put such a workload on the kidneys, for example, compared to so for example, if you're still feeding an all life stage food to some of these senior pets, you just looking at that, You're going to have higher levels of the phosphorus, the calcium, the sodium. And we know about some of these older age conditions that they just don't need those higher levels of minerals. And then protein, we want it more bioavailable. So if you're just giving them a lot of extra protein, there's only so much that the body needs. And once protein synthesis, so there's that cap, we call it the limiting amino acid, because that's really what cats and dogs need is amino acids, not protein. But once there's that point where there's no more protein synthesis going on, anything after that is just extra. And you end up, say, with a lot of brown grass, which we don't. The dogs don't need to have to process all those extra minerals to produce a lot of brown grass. So keeping it for a senior pet, keeping it in that more controlled level is going to be better for that senior pet in the long run.
I think that's great information, but it's all very scientific. How can we effectively guide the conversation around pet food when talking to the owners?
Absolutely. And that's a good point, because you're right. I gave you a lot of very scientific-y kind of stuff. I think really what we should be saying to the pet parents is we want their dog or cat to be around a very long time. And obviously our goal is to help lengthen the life, but also quality of life. So feeding a senior food that the research has shown is most appropriate for a senior pet. So again, those are the companies doing research, is hopefully going to keep them with us for a long time. And obviously, they're not going to be here forever, but we want them to be with us as long as possible. And we want that high quality of life. And I think when you look at a food that truly is for senior pets that have controlled minerals, you don't have to go into all the minerals, but controlled minerals, that hopefully that is going to accomplish that.
I like that. Giving them a little bit of that scientific information, but not overwhelming them.
Exactly. Exactly. Yeah. Yeah.
So, once we've done all of this and a food is chosen by the owner, what important information do we need to give them before they head out the door?
And that's a great question, because as I mentioned before, and I hope no one is doing this at their clinic, but if you're just handing the bag to the owner and saying, here's the bag of food, have a great day, that is not what we should be doing. We need to continue on and help the owner as they're navigating to change to that new diet. And that includes talking about, most importantly, how much to feed. The bag is going to tell them how much to feed if that is the sole source of nutrition. But maybe they're going to add in some canned food. Maybe they're going to add in treats. We know treats should be no more than 10% of the total calories. But keep in mind that, say, that bag of food is a complete and balanced food. So that's saying if this is the only thing that that cat or dog is going to eat, this is how much they should be eating. So I truly believe that we should be calculating out how much they should eat, and let the owner know the calories that that dog or cat is going to get for the day. I truly think that that is very, very important. And that's something we can do. Vets, techs love doing this stuff, right? So a little bit of math, but it's pretty easy. And then we can tell them, okay, so your cat gets 260 calories per day. Now we can figure out how much of that is going to be dry, how much is going to be canned. And then if they want to do treats, we pull out 10%. And now we know how many calories can be from treats. And we always say there should only be 10% of calories from treats, but what does that really mean to the pet parent, right? I don't even know how many calories my cat is or my dog is supposed to get. But by doing those calculations, you can now let them know these are the amount of calories your cat or dog is going to eat. And I'm going to help you figure out how much dry and how much canned. And then say you come up with a recommendation and then they come back and they say, you know what? Actually, they really like the canned food. I'd like to give more. No problem. We know how many calories the cat or the dog is going to get. We can do those new calculations for you. So see how we're providing those benefits for the pet parent? But also we want to make sure we're talking about a measuring cup. It is an 8-ounce measuring cup. It is not a 64-ounce big gulp. We all know that. But we need to say it. I think sometimes we think, oh, they know it, but no, they don't. Because the amount of times I've seen a 64-ounce cup, I give one cup to my Chihuahua. It's like, no, way too much, right? And then also we need to talk about a transition. Really, really important. Particularly if you're going from, you've got, say, a cat that's only been on dry their entire lives, and you're now asking them to give canned food. Our pet parents' expectation is they're going to give them that new food and they're going to love it and they're going to eat it immediately. Well, we know that cats have texture issues. And so it's not about the flavor. It's not about the taste. I've never had canned food in my mouth. It's different texture. And we know that it could take about 30 days for this cat to kind of get used to the new texture. And we need to make sure we're advising the owner of that so that they're navigating. And yeah, they may have to throw some food away, but it's not, may not happen in a day. We also know some dogs and cats may have GI upset. And so if you're switching to a higher, lower fiber, or you're going to a hydrolyzed protein, there is more opportunity for a GI upset. So we want to make sure that we're talking about at least a 7-day transition and then longer if needed. So sometimes for our cats, we need to go longer. We need to understand cats are finicky, meaning they have texture issues. We call it finicky, but it's texture issues. And some dogs do as well. Like I had an older gentleman that had a dog, a poodle that was overweight. It'll all make sense in a second. He was feeding this dog 100% lunch meat from a deli. So that dog was not eating dog food at all, and he was very overweight.
It's a very spoiled pup.
Very spoiled puppy, or older dog actually. And so we actually were able to get that dog over onto dog food. Took some time, and obviously we still added a little bit of lunch meat into that food because that was something that was very important for the owner, but it took some time. So this is where we really need to handhold our pet parents. We need to be the advocates for them, but also most importantly, we're being the advocates for the pet because that's really what it's all about, right? So a little bit of time, not too much, but the success of getting them onto that new food is so rewarding for us, and we know we're helping our patients.
Yeah, you brought up so many great points. I'm glad that you talked about how long that transition can be because 30 days is a long time.
Mhm.
And I think if owners know that up front, they will be more patient with the process. I've definitely seen where owners feel like it just didn't work and maybe didn't give it enough time.
Yeah, I hear that all the time. And that's why following up, I think, is the other most important piece to
Sure.
as we are kind of working with that client, talking about as they're going out the door. But then I think we honestly should be doing follow up. And I hope that everyone is. And if you're not, it's something you want to consider because this is where they offer the food, the cat or the dog doesn't immediately dive into it and they go, "Oh, doesn't like it," and they give up. And we know that by doing a little bit of time and maybe throw a little food away, that's okay. Hopefully there's a in the house that might like it if it's something they can eat. But if they have to throw a little food away in the long run, once we get them onto that food, we're going to see that success. And I actually had that happen with a cat of mine. So good technician, right? I'd only fed dry food. She had kidney disease and she needed to be on canned food. Took me 29 days to get her onto the food. So first she smelled it, then she licked it, then she finally started really eating it. And so if obviously I could do my own follow-ups, but if that was an owner who the cat didn't eat the food and I wasn't following up and holding her hand and saying, no, give it more time. Oh, she smelled it. Okay, that is great. That's something. Oh, now licked it. She's looking. Okay, that's great. We are progressing. And then she's looking at more. And so having that follow up, I feel, is so important for us to really, handhold, so to speak, the owner, because we know that it's going to take a little time, particularly when there's a texture issue, or you really have that spoiled dog that the owner is convinced will never eat dog food. Yes, they will, but it does take some time.
Yeah, I like that idea of guiding the conversation in that positive way to sort of keep the owner going and so that they don't feel deflated by it.
Yeah, absolutely. We absolutely need to be there to help them because I feel like the owner will give up. And I always say that dogs, particularly dogs and cats as well, they have more willpower than our pet parents. And so we need to help the pet parent understand that the dog has been getting lunch meat his entire life and he's just holding out. So a little lunch meat with the kibble, getting them, adding in some flavoring, getting him to eat the kibble, that to me was golden. He ate another kibble, but it was a lot of hand holding to get those pets. And I had to hold my own hands as I was navigating switching my cat over to eating canned food when she had a kidney disease. And it was 29 days, she ended up she was on KD for 5 years. And I have, unfortunately, she has passed away, but she passed away at 16. If I had given up, I would probably have not had 5 years. So it seems daunting in the beginning for the pet parent, but when you think about that, and obviously we don't know, each pet is individual, so we don't know how long that individual pet will have. Mine thankfully was 5 years. But I know that by getting her onto that renal diet, that's what helped her live a longer life and in such a high quality of life. So we need to, I was obviously willing to do that, and that's where I think we really can step in and really help the pet parent and get them to understand, no, this is something. I realize it's daunting. You've got a picky cat, but we're going to help you through it.
Yeah, you're right. It really is so worth it. And I know you talked about doing the calorie breakdown with the client, which I think is a great idea because I think most people understand the concept of calorie counting.
Yep.
And if we're able to do that before the cat or dog is old or older, right,
Yeah.
then you're preventing obesity, which we know can cause so many issues, especially osteoarthritis.
Hmm.
So, yeah, I'm just seeing how much more time people can have with their animals just by having those conversations.
Yeah, yeah, absolutely. They're going to feel better. They're going to be healthier. So that's something that we can absolutely be navigating and advocating for our patients, so to speak, our dogs and cats that we're taking care of.
Thank you so much for joining us today. I loved talking about nutrition with you, especially navigating owners through understanding pet labels and especially those with older pets, kind of knowing what their pets need. So, thank you so much for sharing all of that information with us.
You are so welcome. I'm so excited to have been able to talk to everyone, and I hope some of our tips have helped. And as we take care of those amazing pets that we get the privilege of taking care of. So thank you so much.
And thank you to Hill's Pet Nutrition for partnering with us for this Tech Takeover edition of Vet to Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, great patient care starts with self-care.